Good morning or good afternoon. I'm not sure what time it is. My name is Jim Durkin. I am the House Republican leader from Western Springs, Illinois, and thank you for joining us today. Welcome to our 6th Diabetes Awareness Day event in Illinois. The Illinois Legislative Diabetes Caucus has worked very hard over the years to raise awareness for both type 1 and type 2 diabetes. We have held many screenings and events across the state to encourage early detection and treatment of type 2, but today we are going a different route. In partnership with the Illinois Department of Public Health and our hosts Blue Cross Blue Shield and Novo Nordisk, and many of our esteemed advocates, we are pleased to announce the state's Comprehensive Diabetes Action Plan. I was a very proud sponsor of House Bill 2199 when it was signed into law July 18, 2013 to create the Diabetes Action Plan, because this is very near and dear to me, but I am even prouder with the resulting group effort that came about. Public Health, through a federal grant, was able to bring dozens of stakeholders to the table to all collaborate to create a great product. With the new data showing 1.3 million Illinoisans living with diabetes, 500,000 more than reports just 5 years ago, this is even more important now than ever. It's more important to me because back 8 years ago, my daughter woke up after losing weight, not being herself, her eyes rolling in the back of her head. We rushed her to our internist who took her blood sugar, and she was 600. And so we were in a panic. They said, you have to get her down to Children's. So I rode shoulder on Stevenson and Lakeshore Drive to get my daughter, who I thought was in a very, very serious condition, a very fatal condition. We rushed her to Children's Memorial, where they told her my daughter was a type 1 diabetic. So I'm better than I was 3 years ago, because 4 years ago or 3 years ago, I'd be crying right now thinking about my daughter, because as a parent, your job is to take care of your children and to find solutions to all the problems that they have. I can't do it with this, but what I do is that I spend time researching, but also I take the opportunity to educate people throughout the state, and particularly on the floor of the House of Representatives, that there's 2 types of diabetes. My daughter was born with type 1. She did not get it from lack of activity or from having bad nutrition habits. She was born with it. So I just need to remind people that there's 2 types. Neither one of them is good. But it's important that we are recognizing that there is almost an epidemic. I think it is an epidemic that's coming throughout the United States and also in the state of Illinois. And we need to educate people, but also get in front of it, because it is a public health issue, and it also has a very substantial cost upon the Illinois taxpayers. So that is why this is important to me. It's very personal, and I want to thank everybody from the ADA to GADRF for keeping my head screwed on straight as a parent during some very difficult times. So right now I'd like to introduce the Director of Public Health, Dr. Nirav Shah, who will unveil the details of the plan. Doctor? Thank you.
Good morning, everyone. Thank you very much, Leader Durkin. My name is Nirav Shah, and I'm the Director of the Illinois Department of Public Health. I'm delighted to join everyone here today, our friends, colleagues, and stakeholders, to highlight the important work that IDPH is doing along with the stakeholder community to address diabetes in our state. I was a little bummed out a couple hours ago when I got an email from Nicole indicating that the diabetes walk, which traditionally follows this event, was off for today because of the cold weather. No one was more sad about that than my dog, who has actually been a participant in that walk for the past couple of years. But I understand that the walk is going to be rescheduled, and you can be sure that Quincy will make an appearance at that. As Leader Durkin mentioned, more than 1.3 million people across the state of Illinois have diabetes, and over 3.5 have pre-diabetes. Combined, that is roughly a third of our entire state that either has diabetes or is at risk for it. Now, the consequences from a public health scale for these numbers are staggering. Individuals with diabetes are 2 to 4 times more likely to have a heart attack or a stroke. And individuals with diabetes in general are found to have a more poor health status as compared to folks who don't. The bottom line is that chronic diseases like diabetes are the leading cause of death and disability, not just in Illinois, but across the country. And they account for more than 85 cents for every single dollar we spend on health care. In Illinois alone, that amounts to over $12 billion in our healthcare system that are spent on diabetes or on prediabetes. Unfortunately, the effects of diabetes and prediabetes are not visited upon our population evenly. African Americans, Latinos, and South Asians are much more likely to have diabetes than their counterparts. This comes at a time when our ability to care for and treat diabetes are ever accelerating at a tremendous pace, thanks in part to our researchers, scientists, and our colleagues at Novo Nordisk and other pharmaceutical companies that have joined us here today. So at the same time, our scientific ability and our clinical ability to manage diabetes is at its height. The epidemic is getting worse and worse and worse with each passing month. Now, we at the state of Illinois and our counterparts and our stakeholders are not sitting on our hands. And over the past several months, we have worked collaboratively to create an Illinois Diabetes Action Plan. This plan is the result of a comprehensive, collaborative effort to prioritize diabetes prevention, treatment, and control across the state. The plan focuses on 3 priority strategic areas. The first is a better use of data and health information technology. Simply put, we have the data out there to tell us who is potentially affected and what we need to do, but we haven't always integrated those data systems to give us a clear view about how to move forward. The second element of the plan is a focus on finance and reimbursement. It's fitting that we're here in the building of Blue Cross and Blue Shield of Illinois, as we all know that unless diabetes priorities are tied to financial and reimbursement activities that make coverage for prevention a priority, actually moving the needle on diabetes is difficult. And the third, and perhaps the most important element of our strategic plan, is a focus on community and clinical linkages. It can't be enough for individuals to manage their diabetes with a 10-minute visit with their primary care doctor every few months. That's necessary but not sufficient. What's needed is a strong linkage to individuals in the community who can help support individuals with diabetes when they're not in their doctor's office. Our plan prioritizes each of these strategies on top of the existing work that's being done by our stakeholders. In close, I'd like to thank those groups. Over 80 groups of stakeholders participated in the creation of this action plan, and I'd like to just thank every one of those groups, many of whom are here today. Without that input, we would not have been able to create the plan that we have in service today. So thank you all for your partnership. Thank you all for your support. Moving together, we will most certainly make a dent in the diabetes epidemic across the state. Thank you very much.
I would like to introduce now Clarita Santos. She's the Executive Director of Community Health Initiatives for Blue Cross and Blue Shield of Illinois.
Thank you, Leader Durkin. It is our pleasure today to host Director Shaw and the Illinois Legislative Diabetes Caucus to help create awareness around this very important issue. The Blue Cross and Blue Shield Association found that nationwide, diabetes has a greater health impact on commercially insured Americans than COPD, breast cancer, and asthma combined. At Blue Cross and Blue Shield of Illinois, we see how this chronic condition impacts our members, our families, and our communities. And we have dedicated many of our resources to building awareness and providing support. Through our community giving, Blue Cross and Blue Shield of Illinois has invested nearly $150,000 this year to support organizations to help individuals and families identify and manage diabetes. We also offer innovative and collaborative programs for those living with diabetes now. Blue Cross is piloting a program to offer free diabetic retinopathy screenings at health clinics in Chicago. Did you know that diabetic retinopathy is the most common cause of vision loss among people living with diabetes? But with early detection and treatment, vision loss can be prevented. This year, we also launched the first endocrinology accountable care organization in the country. This ACO gives members with conditions like diabetes greater access to care coordination and illness management. And this month, we're partnering with Jewel Osco to offer free Managing Your Diabetes classes. So we like to be where the community is at. We're also helping our members via social media and our smartphones. We've launched a social media campaign, hashtag BCBSIL Faces Diabetes. It features educational materials, and it also is an opportunity for folks to share their personal stories. And by sharing their personal stories, to create a network of support and encouragement. At Blue Cross, we're also piloting a 15-month-long test of 2 very popular diabetes prevention and apps, but we want to validate the possible benefits of these apps. And tonight, we're doing something very special. On this Diabetes Day, the south-facing side of our building, overlooking Maggie Daly Park, we will light with the message, Stop Diabetes. Thank you to everyone for coming out today to raising awareness for the detection, prevention, and management of diabetes. Together, we will make a difference.
Thank you, Clarita. I mentioned earlier that we have a diabetes caucus in Springfield. You wonder what we do. What we do is that we try to raise money, and we have every year we have a bowling night where we rent out a bowling alley in Springfield. So if you ever have a reason to come down to Springfield for anything, it's one of the funnest events we have. We rent out the place for the night. Everybody has a great time. We have shirts made out, and we raise money for our caucus. And what I think we should do with our caucus, we've talked about it before, is that there's the ADA camp for kids who have type 1 diabetes. I'm obviously focused on type 1 diabetes. And my daughter's fortunate enough to have parents who have the resources to be able to send her there every year. Because it's important, because she grew up and she was alone. When she went up there, she made friends, and she knew that there was a safe place for her outside of her home. But she knew that there were hundreds of kids who also were going through the same struggles that she were. She's on her 6th year right now, and she can't wait to go back. So I think there are kids out there and their families who don't have the ability to finance this ADA camp. And I'm hoping that the caucus, when we raise our money, that we're going to be able to put money towards awarding scholarships to families who don't have the resources to send their kids to these camps. And it's a wonderful place, and I think it's a great investment. For those of you who've helped us over the years, your money is being spent wisely. But it's important that all kids, whether they come from means or their families are struggling, to know that there is a safe place outside their home, and that there's kids who are in the same place as them who can share their thoughts and how they manage life. Because can be managed. My daughter's great because she manages as well. She grew up way too early because of diabetes, but the fact is she's doing an amazing job, and I'm so proud of her. So I also, I'm very fortunate to have my colleagues here who've come up. Some of them have driven a short distance, some came from a long distance. I'd like to introduce my good friend who's retiring at the end of this legislative session, my Chief Deputy, Patty Bellock, who has been at the forefront on every health issue related to the state of Illinois since I've been down there. So Patty, if you could at least address and say a few words, it'd be great.
Thank you very much, Jim. And Jim has been an outstanding leader in the House of Representatives, besides a leader of the Diabetes Caucus, along with Tim Butler. But thank you all for being here today, and thank you, Blue Cross Blue Shield, for hosting us, and everybody else that has supported us downstate on this issue, because we know that this is a public health epidemic, as Dr. Shaw had said, and everybody else. And those of us down in Springfield will do anything we can to help out in addressing this issue, health-wise, bowl-a-thon, whatever. And I want to thank all of you and thank all the legislators who, everybody has been behind it. We did something downstate, on the 9th to promote it also. Several of us are the National Women in Government Task Force on Diabetes, so we hope to spread it through all legislatures throughout the United States, the importance. But Illinois, I think, is a leader, and I want to thank especially Dr. Shaw for being such a wonderful director of our public health in Illinois. So thank you again for everything, and hope you come down to the bowl-a-thon. I've already recruited some winners. Thank you.
Patty, I don't call them winners, I recruit ringers when I put my team together. But I'd also want to introduce, I said people came from a short distance and also people came from a long distance. I think that the next speaker came from a short distance, a freshman member of the legislature, Representative Teresa Mott. Teresa, would you like to say a few words?
Thank you so much. It's a pleasure to be here, and I couldn't be happier to be a new member of the Diabetes Caucus and to be involved in this work. And I encourage all of you to come down to Springfield and help us out with our fundraiser. This week, or actually this month, I am having an event in my district to promote diabetes awareness, and it's one of the initiatives that will take us deep into the community, where we will spread the word in the areas where the information is much needed. So I look forward to working with all of my colleagues on this issue, and thank all of you for your support as well. Thank you.
Thank you, Representative. And now I'd like to introduce from Springfield, Representative Tim Butler, who's been very active with this issue, and I can't be more proud of how he has taken the Diabetes Caucus and helping us out on so many issues, but also raising money, being very proactive with me and also other members on legislative initiatives that come before us that are related to this issue. So, Tim, would you mind saying a few words?
Well, good morning, and thank you to Blue Cross Blue Shield on hosting this event today. This is a wonderful event to have on Diabetes Awareness Day, and as with Dr. Shaw, I'm a little upset that we're not having the walk today. It's like 50 degrees outside. Come on. I mean, it's Chicago in November. I mean, what do we expect? I was here for the Bears game on Sunday, and it was raining and pouring, so. Well, it's an honor for me to be here as co-chair of the Diabetes Caucus in the House, along with Representative Will Davis. I'm not quite sure how I became co-chair, other than the fact that my friend Mike Tryon approached me before he retired and knew I had an interest in the issue, and it's been a real pleasure for me to be involved. So, as Patty has said, and we try to do some good work in Springfield. The bowling event was a fun event this past year, and we've had some discussions on maybe doing some other future events as well. So we'll continue to do all we can in Springfield to try to fight diabetes. To Dr. Shaw, I'd have to say this is a great day to announce the action plan for the state of Illinois. I spent a few years working in healthcare for a hospital in Springfield out in our communities, and I represent this part of the city of Springfield, but outside of that, my district's largely a rural district with small communities in central Illinois. And we have a big problem with diabetes in a lot of our rural areas as well, and it's a problem across the state, as was highlighted earlier with the number. And so I appreciate Dr. Shaw being here to unveil the action plan and to move forward to combat diabetes. Hopefully one day we won't have to have a Diabetes Awareness Day because we've addressed the problem sufficiently. But until then, we're going to continue to support the cause and do all we can. So I'm happy to host you in Springfield. I'm not a very good bowler, so I'm always looking for ringers as well. So you're more than welcome. Thank you.
Thank you, Tim, and I appreciate the work you do on behalf of the caucus. I'd last like to introduce another freshman, David Olson from Downers Grove. David, if you'd like to step up and say a few words, I'd appreciate it.
Thank you, Leader. I think this is really an important issue. As you can see, we have a broad group of legislators from different parts of the state, bipartisan, because people are wanting to come together and talk about this issue. We need to do more to work with our citizens and constituents all across the state to help promote awareness and make sure people are getting screened appropriately. So this is an important day. Thank you for being here. Thank you for all you do each and every day. And let's continue to work together to really address this important issue in our state. Thank you.
Well, I would just like to thank everybody who's involved with this. The most important way to address diabetes, either 1 or type 2, is through education, through knowledge, like with any other disease. And for me, it's been a learning curve that didn't take a long time, but the fact is I understand more of it. But know that there's many members of the General Assembly who won't tell you that they take metformin every day because they have type 2 diabetes. So understand that the legislature does understand the issue, but don't be afraid to ask us if there's a way in which we can help you to get the message out, or to help those who need help who don't have the resources to be able to manage this terrible, terrible illness. So with that, I want to thank you very much. Dr. Shah, thank you for your advocacy, but also everybody in this room, Blue Cross, Novo Nordisk for helping us trying to get our arms around this very difficult issue, but also to bring awareness to people throughout the state of Illinois, and also at the same time, when we can, provide comfort for those who are in need. So thank you so much, and have a great day.